Assalamu alaikum. Masa al khair. This is good evening. This is Dr. Asiri, a board certified plastic surgeon and a board certified hand surgeon. I will be sharing with you. I recently passed with the flying colors the European Board of Hand Surgery exam, and I was the only Saudi candidate who has passed this exam for this year. So I will be sharing with you one of the common scenarios that come often in the exam, and I will be presenting a case of a patient with a left index a manual worker with a left index exposure, the left index laceration over the flexor tendon over zone number 2. So the video will be a little bit short. I will try to make all my videos around 4 to 5 minutes, and sometimes they can be more. And if you have any other suggestions, there will be always captions in my videos, so it can be easily followed. Please follow up with me. I will be waiting more and more for your valuable feedback. These are simply to help candidates who are setting up for a future exam to pass the exam as I have done, and it can be used for people who are sitting for the European Board of Hand, European Board of Plastic, or national boards of hands or plastics. So we'll start with this scenario. So this is what we will have. So you'll have the patient with a 55-year-old patient, office worker, sustained a several laceration over the left index finger after work-related injury. The injury involves zone number 2 with a complete cuts of both flexor digitorum profundus. This is the description that you should provide the examiner. And with a complete cuts of both a flexor digitorum profundus and a flexor digitorum superficialis. When it comes to the ulnar digital nerve and the artery, they are also injured. And in that case, the key anatomical feature in zone number 2 from A1 pulley in the palm to just distal to the insertion of the flexor digitorum superficialis tendon. Both flexor tendons reside in the tight synovial sheath with pulleys that prevents the bowstringing. So poor tendon gliding can occur after repair due to the tight tunnel. In my workup, I would include the radiographs if a fracture or foreign body suspected. I will perform a detailed physical examination. I will assess for capillary refill and sensation, and I will be testing for active flexion of a distal and proximal interphalangeal joints to determine the involvement of the tendons. Then treatment approach, I will do an early exploration and repair of the cut structure for tension-free approximation. I will repair the digital nerve and the artery under microscope with a 10-0 microsuture. The key principle of my flexor tendon repair, I will be doing an extended incision for the tendon retrieval. I will preserve parts of the A2 and the A4 pulleys to prevent the bowstringing. I will recreate the exact tendon orientation, use at least the 4 core sutures, preferably locking sutures with an epitendinous suture. And if you do the epitendinous suture, you will start with the posterior part and they will go with an anterior part. I will carefully repair both tendons to avoid gaps, and I will vent or open the pulleys if needed, and then I will close the wound meticulously. I will apply a dorsal blocking splints with the specific joints. When it comes to there is no alternatives for such a treatment, because the ideal time of repair, it will be around less than 3 weeks, and the earlier is the better, because it will be delayed the primary repair. Optimal treatment for a flexor tendon repair with at least 4 core sutures. I will preserve the A2 and A4 pulley, and you release the position as necessary, and then I follow the early active motion protocol, because this is what I find more suitable for our patients. you have to know that some of the complications, it could include infections, tendon ruptures, tendon adhesions. I will start with an early active rehabilitation protocol, as I have mentioned. For me, I don't ask the patients to do any rehabilitation protocol for at least for the first 48 hours, and then it will be a passive motion and then active motion, and then I will go until they can regain full function. So I hope this was beneficial for all of you. Please follow me, and I will be happy to answer all your questions. This is episode number 2, a flexor tendon injury oral exam case. Thank you very much.